The statistics so staggering they cannot be ignored. 30 times more people in Indiana infected with HIV than in a typical year. And if you're not impacted already, those on the front line say it's only a matter of time. One-track mind. Addicts fueling HIV's fury.
I've got two brothers that, that has tested positive for it.
I knew it was coming because it was too open.
It's much easier for someone to lie to you than to tell you the truth.
The infected often unaware of who's really sharing their bed.
I had only been seeing one certain gentleman, so I knew that that was who had infected me. And he tried to tell me for the longest time that it couldn't have been him. There was no way it could have been him. And then I found out later that he had a wife that had died of AIDS.
Kim Vaughn takes 20 medications a day to keep her condition under wraps. Just one specifically for HIV. The rest treat related symptoms.
My muscles and joints are really sore all the time. I get infections really easy.
She's been HIV positive since 2000, according to the AIDS Resource Group. She's one of more than 300 people in Vanderburgh County living with the disease. Kim's diagnosis discovered while getting help for alcoholism, a vice she admits lowered her inhibitions. It was tough on her kids and tough to tell others. Kim says it took almost 4 years to start a new relationship and share her status.
There's probably more people that are hiding the fact that they're positive because they don't want people thinking bad about them. They don't want people looking down on them.
That's partly what's triggering an epidemic-declared outbreak in Scott County. The Indiana Department of Public Health reports 150 new cases since mid-December. Typically, there are just 5 in an entire year.
I know there's going to be a lot more because there's still, like 130, I think, contacts that they're trying to find that are contacts of people that have HIV. So those people probably have been, had access to the HIV virus and are more probable to be positive. So I know the numbers are going to go up, and I know it's going to spread outside of our county too.
It may have spread to Perry County, one of 5 listed in February as being of concern due to an infected person having blood-to-blood contact with someone there.
It was mainly the jails. They were actually from Scott County, but they were in the jails in other counties.
At the heart of the epidemic, injection drug use, specifically Opana, a powerful opioid painkiller. Experts feel its abuse started to worsen in 2013. That's when the Indiana legislature passed new requirements for doctors who write such prescriptions. More of it now sold on the streets, and as drugs travel the interstate, some believe it's only a matter of time before new HIV cases start showing up in Vanderburgh County.
Our community's health is at stake.
Lisa Nelson and her staff at the AIDS Resource Group in Evansville are assisting healthcare workers in Scott County. ARG tests for HIV, connects patients with treatment and other resources. They also administer what's called safer injection kits, which include tools to sterilize needles. Some find that controversial.
This is not a morality issue, it's a health issue. So if we could provide an environment where people could get safe needles, I think we could see some numbers come crashing down.
Indiana has a statewide ban on clean needle exchanges, but Governor Mike Pence lifted it temporarily in Scott County.
Everybody gets a sharps container so they can put their old needles in it and bring them back in a week.
The program in its 2nd month, the Scott County Health Department says it's provided more than 10,000 clean needles and received almost as many that are dirty. Their involvement documented to avoid criminal charges. Public health nurse Brittany Combs says most admit to injecting Opana.
It's been shocking, absolutely shocking. I mean, they use it until the needle literally breaks off in their arm. 300 times, I heard someone say. Some people will say, I use it for 2 weeks. They take a file and they'll file it to make it sharper so they can use it again, and it's just sad.
Combs drives one of the clean needle exchange programs by SUV right to the epicenter of the outbreak, Austin, Indiana, about 35 miles north of Louisville. Injection drug use is rampant here.
We found them in the ditch, along here and everywhere. Got to watch when you mow.
They're pretty open about it. I mean, they don't care.
I've seen kids that has them at school.
Addiction, a tired trait of this town of 4,000. Even who's infected is common knowledge, like David Reed's brothers, who he says tested positive last month. Reed says they're still shooting up.
He looks at it that, I've got it, I'm dying, He looks at it that, that there's no help for him no more because, just because they test positive, they think nobody cares for them.
It's not a death sentence like it used to be. When I first found out, that's the first thing I thought, oh my God, I'm not going to be here to raise my kids. I'm not going to, I'm not going to be here to help my mom. I'm not going to be here to, see my grandchildren.
Reams of patients are resilient, like Tim Baker of Chandler, HIV positive for 34 years. It doesn't come easy.
What's going on today?
Evansville nurse practitioner Denny Myers treats about 250 patients like Scott who are HIV positive.
Very hyper-reflexic.
He's one of 2 board-certified HIV specialists within 100 miles of the tri-state. According to the American Academy of HIV Medicine, there are just 15 medical professionals who specialize in HIV in all of Indiana.
There is just something about this disease that scares everybody, and even in the medical profession, there's still some stigma. I've had people I've had to send out of town for certain surgical procedures because certain medical people or whatever didn't want to deal with them or didn't feel that they felt secure in dealing with them.
One possible deterrent, Myers says as many as 90% of HIV patients quit treatment after the first month. It's time-consuming for both parties, and the medications have strict guidelines, let alone expensive.
Rayataz is over $1,000.
Myers asks patients with ineffective medications to bring them in so those without insurance could see if they'll have better luck. Now, some good is coming from this. More people are aware and getting tested. Myers says that includes patients in their 50s, 60s, and 70s. In Scott County, the health department's testing an average 50 people a day.
What has the workload been like for you since this all started?
Absolutely insane. It's been nuts. And we're working 60, 70 hours a week. This is a very small health department. I'm the only public health nurse for the whole county.
Combs says this epidemic has given them access to people they didn't know need help and connecting them with a gamut of resources. Even some now taking steps to get into rehab.
It's not about just throwing needles at them. That's not going to help them, and they get that.
Back in Evansville, education remains ever important. Watching from afar while knowing naivete puts everyone at risk.
If I can educate one person who actually fears this disease into better understanding of the processes involved and maybe entice them to go get tested, then we've been successful today.
When stigma ends, epidemics end. Until then, people are going to be afraid to get tested. People are going to be afraid to take medications because what if someone sees me? What if someone sees my pill bottles? They don't want to admit. They don't want other people to know they have HIV because of the stigma and because of discrimination. So until, in my view, until we end the stigma, we will always have HIV. So we have to stop the stigma.
Important to note, Indiana law requires people infected with HIV to inform their sexual partners of their status. Otherwise, they could face criminal prosecution. Very few do, though. The Indiana Department of Corrections reports just 18 people over the last 15 years have served time for failing to report their disease.
And there might be a turning of the corner on this. A report today by state health officials saying that they may be making some progress on this. The number is up to about 150, but that may
That's
be
right. It went up by
ending.
just a couple in the last 2 days, and we've been seeing big jumps every week. So it might be slowing down because of the awareness, more people getting tested. So hopefully this is slowing down. And, you know, the Indiana State Health Commissioner created a list of truths and myths about HIV that is now on our website, trisatehomepage.com.